The important thing with brushing a child's teeth is to go from behind. It's very difficult to brush somebody's teeth facing them. Their head keeps going back, you keep walking forwards. So as with babies, usually try to sit them on your lap. The second thing that's important is to get your fingers in the child's mouth. Don't be afraid to get your fingers wet. Make sure to retract and lift the bottom lip, pull the cheeks out. You'll see my fingers are not pulling from the outside. They're actually pulling from the inside. It's more comfortable for the child and it's more effective. That way you see where the toothbrush is and you can see that you're half on the gum, half on the tooth. It's very important. With the younger children, as with this little baby, it's easier to have them on your lap and just kind of relax over your leg. And that way you can pull their cheeks out and their lip out that way. With a 4 or 5-year-old, sometimes it's easier if they are in between your legs and have their head back on your lap, like the older child does in this video. That way you can, again, retract the cheeks, pull back the lip, then you can see where the toothbrush is. That also keeps you from hitting their condyle, which is that bone in their facial bone that kind of sweeps down in their jaw when they open their mouth. If you can't see where the toothbrush is and you're just brushing blindly, sometimes the head of the toothbrush can hit that condyle and cause some discomfort. With the children that are a little bit older, around 6 years old, 7, you can have them stand in front of you like the child also is doing in the video, and you see that I'm kind of holding him against my body and he's looking up at me. Once again, that's so that I can stabilize his head in my arms, which keeps him from hyperextending his neck. And then I hold his head securely, and you'll see that when I'm pulling his cheek open, I'm using my thumb against his cheek and then using the other finger inside so that I can kind of pinch it together gently. And once again, you get your fingers in there. Don't be scared to get your fingers wet. And that's really important to being able to see what you're doing in the child's mouth. Another thing with babies is to, when you lift that lip up, sometimes if they have, it's called a frenum, that little tissue tag that attaches the lip to the bone in front of their 2 front teeth. If that's low with babies, sometimes when you brush across that, it's sore for them. So brush on one side of the frenum and then brush on the other side of the frenum. And sometimes that can decrease fighting of a small child. They might be fighting you because it's a little sore.